Okay. Welcome to another episode of NeNe at Night. I am your girl, NeNe Lynn, Sexpert NeNe Lynn, whatever y'all want to call me, or just NeNe, take off the Lynn. It's been a while since I've been live, but welcome back. And I did this episode special for one of my friends. She's been rocking with me for a little minute since I met her. And she came to me and she was like, listen, what do you know about this? How do we do this? And I'm like, I don't know nothing about it. So I kind of wanted to do the sex and pain topic to go over the pleasurable pain that we feel and the not so pleasurable pain because being a woman and having sex is not always pleasurable. And sometimes we do it for men. And sometimes we have to get out of that and just say no, not today. Don't touch me. So we'll talk a little bit about that. But I do want to let my guests introduce themselves. So, Miss Felicia, you first.
I am Felicia. I'm a chef, owner, operator of the Mad Baker LLC, and also Enchanting Taste Buds Personal Chef Services. I wanted to ask some questions because I'm still learning, and I actually was diagnosed when I was 33. I'm 35 now, and there's still a lot of stuff that I don't know. I also was recently told that I am to the point of hysterectomy because my case is so complicated. So my journey is never ending. But my whole thing on doing this is whenever I found out that you were being certified to become a sexpert, I wanted to ask you what you knew about it because I was always having issues. And whenever you look up any information like relationship wise or anything like that, you just get the negatives on relationship killers and, relationships don't last long and sex is just, painful and there's nothing you can really do. And it's like, well, there's got to be something because people are still having sex every day. So it can't be, it can't be all bad. So I just wanted to learn and I wanted to just get the information out there to know the difference because sometimes there is good pain during sex and just for women to know that when there is bad pain, that they just need to advocate for themselves and ask questions.
Definitely, definitely. And Miss Vontrese.
Well, good evening, everybody. My name is Vontrese Simpson. I'm a board certified women's health nurse practitioner, and I've been practicing for the last 8 years. But however, the last 15 years, I've been a women's health nurse in general. So I've always done women's health. I'm very knowledgeable about different topics about sex, relationships, and women's health issues, men's health issues in general. So I think I'm a really good resource. I think people who know me, and know what I do, patients, students I've had understand, where I come from. I try to come from a really real aspect. I'm not the provider that you see that's going to just, walk around the issue and not give you what you really need. I'm going to sit there and talk to you. I like to educate you to help you understand what's going on with you more better so that you have a better understanding of how your body is and what we can do to make it better, or keep it going strong, So I'm also the owner of a telehealth practice recently opened up called Truth Reproductive Health Services. You can see the link on my Instagram or my Facebook at Truth Reproductive. If you have any information or questions, feel free to ask anytime. You can also check out my link tree that's on those social media sites as well. I am giving out, well, not giving out, but I do women's health consultations. I do medical cannabis certifications, and I'm also a nurse cannabis consultant. So I'll be coming out with a line of CBD products related to women's health to help with some of these issues we might be talking about this evening. That's what I do. I've been doing it for a really long time. I'm not sure if we're streaming straight out of Louisville because I am from Louisville. If for people who do not know me, I'm originally from Louisville, Kentucky, and recently moved up to the Maryland, right outside of Washington D.C. area. So I'm a little bit all over. So if you ever need anything, feel free to reach out.
Okay, okay. So what I did, y'all, is just say I made a post and people tag Vontrese, and actually we were on a panel together a few years ago, and I was like, oh, let me reach out because when I made the post, it's hard to sometimes you got to go through all them people to figure it out. But I seen the name and I knew the name, so I was like, let me go on and reach
Mhm.
out to her because I heard you talk on the panel and everything, so I knew, you know. And
Mhm.
what we need is somebody who's gonna give it to us straight shots, no chaser, because
Mhm.
we don't need the sugarcoating. And it's
Right.
best to have someone that looks like us too, just because simply
Mhm.
put, other doctors don't know everything we go through. They can pretend and tell us and
Mhm.
all that, but it's easier to talk to someone who looks like you, who's a woman like
Mhm.
you. My
Mhm.
doctor's a man, and sometimes I just look at him like, "You're a bastard,"
Mhm.
you know. And I'm like, I just, you know, I'm just familiar with him because he's been with me since I was, 18. Um,
Mhm.
and that's it. But sometimes I be want to be like, I should punch you because you don't know what you're talking about. So it is great to have a woman, and I'm so glad that you are a nurse practitioner because I have learned the difference. Let me tell y'all, between nurse practitioners and doctors. Okay,
Mhm.
um, doctors are doctors. Okay, nurse practitioners are nurse practitioners, and nurses, all just the title nurse, they seem to have a more of something is comfortable about nurses rather than doctors. I don't know, something up with them doctor people that went to
They have
medical school sometimes.
compassion.
Yeah, maybe that's it's a different level of
Sympathy.
passion.
Mhm.
That's what it's because
Mhm.
although
Mhm.
them the doctors went to medical school and stuff. No, I'm not knocking nobody's doctor. It's just something
Mhm.
different about a
Mhm.
nurse practitioner and a doctor. And
Mhm.
if you notice when you go to the doctor, you see the nurses, and the nurses know a little bit more about you than the
Mhm.
doctor does sometimes. That you can get that comfortability with them. So
Mhm.
I'm glad we have it. So we're gonna just start off with, what the hell is PCOS? And what does it stand for?
PCOS stands for polycystic ovarian syndrome. And what that means, it's not just one thing. There's like a conglomerate, like multiple things that make up PCOS. So it's not just one thing. And so um, polycystic means, well, poly means a lot of, so multiple. And then cystic means cyst, okay? Ovarians are ovaries, and syndrome is whatever the disease is, okay? So having multiple cysts or multiple follicles on your ovaries, most likely both ovaries, is one of the symptoms of PCOS or polycystic ovarian syndrome. Most people who have PCOS are overweight. Okay. Sometimes they have irregular facial hair or some kind of hair like on their body that wouldn't normally grow on a woman, you know. Not everybody has the same symptoms. Sometimes you have just thick hair that you can't get rid of. Sometimes it's difficult to lose weight. Sometimes your periods are abnormal. Okay, you don't know why. Sometimes you might be borderline diabetic, borderline high cholesterol, and all these things because your hormones are out of whack. And all of those in combination can make up PCOS. The way to diagnose it isn't just by one thing. So let's say I have a patient come in and say, "Hey, Vontrese, I've been having, irregular menstrual cycles for the last, couple years. Um, I don't know what's going on. I used to have regular cycles, but I have, I gained a bunch of weight after my baby. I don't know what happened, or I've been depressed and I've just been eating and I've been gaining weight. Um, my blood sugars, I'm not on any medication, but my sugars are a little bit up. I'm trying to lose the weight, but it's difficult for me to lose the weight. I got this facial hair, like it's just thick. I don't know where it came from. Like things like that makes me think PCOS. So let me send you out for an ultrasound so I can see what your ovaries look like, and let me do some lab work so I can see what the labs look like because there are certain labs that also go along with PCOS. So it only takes two of those three, like whatever the patient says is going on with them, the ultrasound and or the lab results to be able to diagnose someone with PCOS.
Oh, okay. So I have, yeah, because I've seen, TikTok is, the new thing, yeah, and I've seen a woman
Mm-hmm.
with PCOS. She has a full beard. It's like thick
Mm-hmm.
and full. I was like,
Some
man,
some some are less than others. Most are
yeah,
less than others, but that's like the
right,
typical. Yeah. Uh huh.
right. So is there like, when it comes to PCOS, I know that sometimes it can be painful to have sex.
It can be, and the reason being because the female anatomy, the internal anatomy. You have your uterus. At the bottom of the uterus is called the cervix. Okay, towards the top of the uterus is where your ovaries hang off. Okay, and so if you have multiple cysts on both of your ovaries, when you have sex, extra pressure, might be extra pain because of those cysts. It makes it uncomfortable.
So do certain positions for different people more comfortable than others?
I would say I can't say 100% that everybody's the same because everybody's not the same.
Right.
Some people's uterus tilts to the front, some people's uterus tilts to the back. Some people's uterus are a certain way,
Right.
and so the ovaries might be positioned a certain way. So I can't say for sure certain positions, but if you do have those issues, I would just say whatever position works better for you when you're not having all that pain.
Okay, so one thing I would suggest just by being a sex worker, a lot of lube when you doing this too. Lube can be your best friend.
Yeah, I think lubrication would be good. I don't mean to cut you off.
No, you good. Go
For
ahead.
like, I think the lubrication is good for insertion, but I don't think the lubrication would do much for the pain,
Right,
for the
right,
actual
right,
pelvic
right.
pain. Yeah.
Right. Yeah, I don't listen. You gotta that. So extra pelvic. Would you suggest them just not having sex for a while, resting, like with the pain, like
No, everybody's different.
okay,
Some people don't have pain at all. Some people just have like small follicles. Doesn't mean that you have. It doesn't mean that when you have ovarian cysts, they have to be really, really big. They can just be multiple, like little ones. And maybe you don't have pain at all. So
so do
everybody's a
people
little
get
bit
them?
different.
Do people get them removed, or do they just kind of? How's this?
No, usually with PCOS, the follicles are so small, it's just a bunch of them on the ovary. And so
Okay,
I think what you're asking is some people just have regular cysts that pop up and they
okay,
can grow. And those are the most painful ones.
gotcha. Okay,
And
okay,
so during the woman's menstrual cycle, you have hormonal fluctuations, throughout the cycle, which is normal. But sometimes, your ovaries make follicles in order to excrete the egg every month. And so sometimes those follicles just continue to grow and grow and grow and get filled with fluid. Sometimes they resolve on their own. Sometimes they get so big they rupture and it's painful. Okay. Sometimes they get so big and they don't rupture and it's hella painful. And it's like you can't stand up straight. You're sweating. You're hot. It's painful. Motrin, Tylenol, nothing's helping. And at that point, it's probably get time to take not the ovary, but the actual cyst, get it surgically removed because it's too painful. And you're at risk for having like an ovarian torsion. And an ovarian torsion means that, let's say you have something small, about this big, okay? And you put something 5 times that size on top of it. It's too heavy and it's going to make it twist. Okay. And so the ovary is connected with vessels and things like that provides blood flow to the actual uterus. So if that's twisted off, that blood flow's cut off and it's a whole problem. So that's why it's important to know, if you're in pain and if how far the pain is going. If you can't tolerate the pain, don't try to. You need to do something else to make sure, your pelvic area is in good shape.
okay. So Felicia, you said that you have this, correct? You have PCOS, correct?
I have
So
PCOS, yes.
So with the PCOS, has it affected your sex life or has it affected you in your everyday life? Like,
Oh, yes. Um, yes, I distinctly, I'm actually in a flare up now. It could be a combination of both, though. So I have a TENS unit on right now, actually. But I do have the pain, the sweating. Sometimes it gets really bad to where I can't stand up straight. I've had to use
Mm-hmm.
FMLA at work. Um, so that's why I'm really trying to work for myself so that I can give myself the proper rest to take care of myself on these days because,
Mm-hmm.
businesses are still businesses, they need to run. But
Mm-hmm.
I do have PCOS on top of my endometriosis. And
Mm-hmm.
actually, I have what I know she didn't mention. I have kissing ovaries, but also because of my endometriosis right now, one of my ovaries unfortunately is adhered to the back part of my uterus on the other side, and then it's also kissing my other ovary.
okay.
So it's not the
So
greatest feeling in the
yeah,
world.
Mm-hmm.
it doesn't sound like the greatest feeling. It sounds,
Mm-hmm.
because it's a lot that goes on in a woman's body. Like you just
Mm-hmm.
really don't know.
Yeah.
Like I know someone told me their ovaries are tilted, and I was like, they're tilted. Like, golly, like these ovaries just do literally what they want to do. Like our bodies are amazing what they go
Mm-hmm.
through and how you're still able to stand. We're able to go through all of this and still be here. But these ovary things just listen, I actually don't even care to have mine.
Oh, you
Like
want your, oh, if you can have them, you want them. Yes, you do. You
I
want
mean,
them.
not like that.
You want them.
I could have them, but I don't want them to produce what they supposed to do. I don't want that no more. I got a 13 and I'm done. I
Oh, I
just
hear
don't.
you.
You just want the good hormones. You don't want the babies. Is what you're
Yeah, there
saying.
we go. There we go.
Yeah,
I
right.
don't.
I
There
feel
we go.
you.
I want them, but I don't want them to do what they do. Because I'm okay with the one child. Like that was enough. That was rough for nine
Gang,
months.
gang.
Like that was the roughest 9 months. I was like, I cannot do this again. There is no. I know everyone's different, but I was like, just my luck. I have the same kind again, and I ain't got time for it. So it's just, but it's different to hear kissing ovaries and tilted ovaries, and this is a lot because while you having sex, I mean, all of this is being affected too the whole time. Like your ovary, and I don't think that guys realize that, like, when we say like you're literally hitting something, like, we say, what are you hitting? There's a cervix right there. Like it's really right there. It's down there. And I don't think they realize you really can hit it. Like you kind of bruising it a little bit. Like, and sometimes guys take it too far. And that without knowing, but because they don't really know our bodies and our anatomy and what's really going on. Um that they don't realize what they're doing to us. And then on top of that, you're adding the endometriosis, the PCOS, heck,
Mm-hmm.
just not even having those, having painful periods. You're adding a lot, like it's a
Mm-hmm.
lot of stuff that goes on in our bodies. And I don't think that oftentimes fellas really realize we're superhuman. If you ask me,
Mm-hmm.
like, we're really superhumans because this is a lot
Mm-hmm.
to say that and the endometriosis is that and PCOS kind of cousins or like distant
No,
cousins?
it's different. It's different. It's a different ball game. So endometriosis, pretty much. So if you think about the layers of the uterus, okay, the endometrium is the innermost layer of the uterus, and that's the uterine lining, and that's the part you bleed out every month when you have your period, okay. And so then you have the actual muscle of the uterus, and so endometriosis is a growth from the muscle of the uterus until where it's not supposed to be. Okay.
Okay.
So the endometrium, like I said, the innermost layer is going into the muscle and it's going all over inside, outside the uterus. Sometimes it's not only on your uterus, it can be like in your abdominal cavity. It can be in other little places too.
Oh,
Mhm.
this is okay. See, I'm learning something. I knew the words,
Mhm.
but just to hear exactly what they are is a whole different.
Mhm.
Because
Mhm.
I was like, I don't even know if they related or not. Like this.
Mhm. Mhm.
So for someone to have both of them, it just adds to.
Absolutely. So if you can imagine someone having a really, so any woman who has menstrual cramps when they have their period, okay, the endometrium, that layer, is contracting, okay, because it's contracting and it's releasing that blood every month, okay? And the more blood you have, or the thicker your endometrial lining is, the more you're probably going to cramp, okay? The heavier your bleeding is going to be. And so, could you imagine that actual layer being inside the actual walls of the uterus, okay? And you still have that same pain, but you have it all the time. Sometimes you
Yes.
have different triggers that make it, that set it off. That's endometriosis pain.
Yeah. And see, I have the heavy. I have the long flow, heavy,
Mhm.
heavy cramps. Doesn't
Mhm.
do it every month, but like, it, I couldn't imagine that because my cramps are when they go.
They
I'd be
gone.
ready to topple over and be
Mhm.
like, leave, just don't
Mhm.
touch me, don't talk to me,
Mhm.
don't even look at me. I can feel you staring at me and it hurts worse. Like it's
Mhm.
so.
Right.
And I have the long periods. People are like, you have what? I'm like, listen, my body. I talk to the doctor. I'm just have long periods at this point.
Mhm.
I noticed that working out helps that a little bit more
Mhm.
than when I
Mhm.
work out controls it a little bit more. But to be
Mhm.
able to not be able to control something like that and then just doing it, I can
Yeah.
only imagine.
Yeah.
Like I want to
Mhm.
hug all the women that have it now because that's just like
Yeah.
that. I
Yeah.
mean, like that is a lot to go through.
Mhm. Mhm.
So now I understand a little bit more, Felicia. When you came to me, now I really see why you kind of like. So there's really no way to make the intercourse less painful. It's just what finding what works for them per se,
Well,
or
Endometriosis, like most of women's health issues, okay, it's fed by the hormone estrogen. Now, estrogen is a hormone that makes a woman, okay? But the estrogen levels, especially in premenopausal women, are where they're supposed to be, and it's feeding the endometrial lining. It's feeding the endometriosis, and that's when you get your all your pain. That's where all the pain comes from. So, in order to try to fix the pain, or try to do like first line methods to try to get the pain under control, if Motrin's not helping, which it hardly ever does, Tylenol is like drinking water. That's not gonna help nothing.
You preaching to the
Um,
poor, Motrin and
you
Tylenol.
know,
Woo.
I'm trying to think like even the Proxen, the higher strength NSAIDs, sometimes they don't touch a thing at all. Okay. You don't want to be on narcotics, but some people are on narcotics because they have this pain that is just terrible. Okay. And you shouldn't have to be, thinking you don't want to get, stuck on a medication, or narcotic, thinking, what I'm saying, you have to have these pills all the time. You don't want to be that either, because that's
Right.
not what you really want, but you don't want to be in pain, So what do? There is a couple things that we can do before surgical option, because anytime you do anything, you want to go from the least invasive thing and
Right.
start from there, okay? Because of course, surgery, you have more risks with surgery and things like that if you have to go that far. But first line of therapy I normally do is to decrease the estrogen. So to decrease the estrogen, I might prescribe you maybe like anti-regulate your periods, okay, make them less. Maybe I'll do like a progesterone only birth control pill, okay. And I say that because birth control isn't just used for contraception, it can also be used to treat um, heavy bleeding, painful periods, endometriosis, and things like that. So it's not just for contraception, but it's absolutely used and FDA approved for these other reasons too. So progesterone only. So progesterone is going to help you stop having a cycle or lighten your cycle so much it might be like wipe, spotty, and go, and that's it. And so if you're not having a cycle every month or it's really lighter, that should decrease the pain. Okay. And some people that doesn't help, you need something a little bit more stronger. Okay. Um, there is the depot shot. That's progesterone only. That's an option, and it works really, really well for people. One of the side effects that everybody notices that some people just gain a lot of weight taking Depo Provera for birth control, which is an IM injection you get every 3 months to protect you from getting pregnant, but it also stops the bleeding. And so some people don't gain a pound when they take Depo. Some people blow up.
Yeah,
So
I was scared of that one because I seen so many people blow up. It's like I don't need to blow up no
uh
more.
huh,
I'm
uh
already a
huh, uh huh,
balloon. We don't
uh
My
huh.
need them.
doctor actually tried to layer the depot shot because my case is
Uh huh.
really complicated. I have a lot
So
of
bad, yeah.
medication sensitivities.
Mhm.
I have an IUD that was placed
Yeah, I was gonna say IUD, Mirena, or
during
like Kylie,
my
anything progesterone.
my endometriosis surgery, and so since I'm flaring up real bad again, he decided to double up and put me on the Depo-Provera, and I had an allergic
Mhm.
reaction to it.
Oh,
Yeah,
Well, right. Jesus.
so
well, I'm sorry to hear that. There is one more thing. There's a medication that came out. I want to say, maybe a couple years ago. It's not new, but it's fairly new. It's called Orlissa. Have you heard of Have you had Orlissa? Have you tried it?
yep. He had me on low dose, and then he had me on high dose, and couldn't
Okay.
couldn't tolerate it. He did that
Okay. Or
before the Depo shot. So, but he actually was just explaining to me. I went and saw him a couple weeks ago. He's wanting me to go to a larger center, like he was saying that there's a doctor at U of L, but he's on a 3 month sabbatical, and he was saying that potentially I could go to Vandy or I could go to the Cleveland Clinic, which I really don't want to drive all the way out there again. But he said he feels like they have a larger center because he said with my case, because I have, which also NeNe, endometriosis comes in stages. There's stage
mhm,
1, 2, 3, and 4. Um,
mhm,
I actually have stage 3 and stage 4 in some places. So, but if I were to attempt another conservative surgery, I'm at risk for damaging my colon and my ureter and potentially not being able to keep either of my ovaries. And
mhm.
he's worried about that because of my age. I guess as he was saying about the hormones with cardiac health and stuff.
Mhm.
So He said he
Well, if you
doesn't
don't
want.
have your ovaries, you'd be in early menopause.
Yeah, and he was saying that he didn't want to risk going in there, and because he's like, I'm not all knowing. He was like, there may be centers that have done more research, past me. And he was like, because I'm going to get in there and I'm going to try and save both of your ovaries, if not just one. He said, and I would hate to go in there and then I can't save either one of them. So he's really been avoiding this hysterectomy thing. So he just wants me to go somewhere else to see if they have any other ideas, because I'm sensitive to so many medications. I don't process a lot of stuff. So
So
Well,
it's
the good
early
thing about what
menopause.
that is. Go
I
ahead.
didn't hear both of y'all spoke at the same time.
Oh, go ahead, NeNe.
No, I was just gonna ask. You said something about it'll send you to early menopause. So is early menopause like a forbidden type thing? Are you try to stay away from it, or like is it a bad
Well,
thing?
if you don't want to go into early menopause, I mean, I'm not a menopausal woman, but I treat and have treated, I speak to, and I know about menopause. Like I talk about it to my patients every single day. Um, Menopause happens when you do not have your menstrual cycle for a solid 12 months. Okay. Some of the side effects that come along with menopause are hot flashes, night sweats, irritability, vaginal dryness, um, being emotional all the time for no reason, at the drop of a dime, all those things. Some people have more severe symptoms than others, but if you didn't have to go through any of that, earlier than what you had to. Most postmenopausal say, I love that I don't have a menstrual cycle because I've been stop wanting not to have any. I've been having no babies, and I've been done with bleeding every month. I'm done over that, but I still have my youth when I still have my ovarian hormones. You know what I'm saying? Before they all, you know, um, shriveled up and went away.
Gotcha. Yeah, because
Mhm.
I realized your cycle is the one thing that stays with you for a very long time. Like
Mhm.
I was like,
Yeah.
dang, this is and I joke about all the time wanting to go through menopause. People like, really? I'm like, listen.
Yeah.
I joke about I know the hot flashes. I'm like, but my cycle's 8 days long sometimes, which I stopped taking. But they had me on birth control for it. But the birth control on me just kind of, had me a little off. Like
Mhm.
I tell people, everything's not for everybody. So the birth control I
Right.
stopped taking. So I pushed through my 8 days. And it's not 8 like full heavy on days. It's just the spot, and I count because them is
Yeah.
still long. So I joke about it all the time. They're like, really? I'm like, I am over this whole me having this thing every month. Like
Mhm.
we've been friends for too long. Like I want to break up, but I don't want to deal with hot sweats in the middle of the night.
Absolutely.
Like
Absolutely.
it's like I
Absolutely.
want to get rid of it, but it's also like, dang, then I got that comes with that too. Hold
It comes
on,
with a lot of other stuff. Yeah, it comes
right? I'm
with
like,
other stuff.
I don't know if
Yeah.
I want to do
Yeah.
both of them,
Yeah.
because my I think when I'm 35, probably got 20 more years before me in menopause. Maybe because everybody's different. I
Mhm.
know some people went through it in their early 40s. But the vaginal dryness thing, I told somebody
Yeah.
just literally said that, just like, you gonna dry up. I'm gonna use lube. It got me messed up. Don't act like my sex life is gonna be messed up because of this. Don't like they were saying that, but it's just it's a lot to go through for one person. Especially you said you're
It is.
35, right? So that's a lot
Mhm.
to go. Like we're the
Yeah.
same age, and to be going through this type of stuff and having to be like, well, it's either this or partially
Mhm.
this.
Mhm.
That's a lot for a woman at any age to go through. Women already
Yeah.
go
It
through
is.
enough.
Mhm.
So like this endometriosis and PCOS is just
So to have them together, yeah, I know you having a time. Yeah.
and see
I was
one of
gonna
my
say that one. Go ahead.
no, you could go ahead. I was just reading the comments.
I was gonna say one great thing that you did say about your physician was that he's not trying to go in and do something that he knows he don't have no business doing. So that's a good sign. That's a because most people just go in there, and not even tell you that. Go in there and do whatever, slice and dice and everything like that, and have a whole different body when you come back. Like what happened, and you don't know. So that's a good thing that he can admit that. You know what, this ain't for me. Let me refer you out. To get some maybe some treatment that they know something more about than me and things like that. So that's a very good sign. And I was also going to say it sounds like you've had a couple pelvic surgeries. I'm not sure. But
I
sometimes
only
you can
had one
develop scar
surgery.
tissue. One, okay, okay. Sometimes you can develop scar tissue too. And so sometimes that scar tissue in the pelvis can make those adhesions with the ovaries and fallopian tubes and everything just kind of stuck together. And that's painful. You know what I'm saying? So all that together with the PCOS and the endometriosis, I can just imagine, honey.
So, do you
Yeah.
think that Felicia, you married, right?
Engaged.
And I knew you was something. I knew you was something. So, is, is your partner, like, just from experience, your partner understanding of everything?
Yes, actually, because it's been a journey, literally. Because not that I've been sleeping all out in the streets, but I've been having these issues literally since because it's been a journey with doctors too. The first doctor who even suspected that I had anything like this, the company got bought and he ended up retiring before he could even recommend my surgery. So that's how I ended up with the doctor that I'm with now. So I see two OBs in the same practice because I didn't know what to do with this thick file folder. This new doctor, he was
Yeah.
probably like getting in his 80s, and it was like a bunch of women. We just had to go pick our files up, and it was just so I took it there and gave it to my OB. It was like, I don't know what to do with this. I was seeing this doctor, and she was like, well, there's another doctor in our practice that specializes in this. But it's literally been a journey because there have been guys that have been like, they don't understand, or one, they don't care they're hurting you. Two, they're irritated because you're hurting all the time. And they're like, well, I'm a man too. I got needs. Okay, I understand that. But I can't do that today. Probably can't do it tomorrow. No, I couldn't do it yesterday. But it's just like, it's from reading the information, it's just an open, honest communication. And you really have to have compassion and open and honest communication with your partner. And if you do that, and they really care and they really want to know, and they care about you, not just the
Right.
act of being with
That's
you.
the thing right there. That's it.
Yeah, they have to care about you. And so my current partner, actually, we had our rough and bumpy time, but it kind of got to a point to where he actually started going to appointments with me, because I usually didn't let anybody in my medical bubble because I got a lot of stuff going on. When he started going to appointments with me, and he was listening to what the doctors were saying, and he started looking stuff up on his own. And so whenever stuff like that started happening, or he felt like that he wanted to approach me in that way, he would be honest. He would say, well, I don't know how to approach you. I don't know if I'm going to hurt you. Like, is there something that's better? He even actually found some information one time and came to me, and he was like, well, apparently, this position may be, better for you. And then I also found out, because I sold Pure Romance for a little bit. One of the ladies, like she said, she had some women say that foreplay, like the buildup of that, it gives your uterus time, like everything that I guess it kind of like lifts out of the way. I guess that was explained.
Yeah.
If like
It's just like when a man has an erection, when a woman is well, a lot of foreplay and she's aroused, the internal organs and the external organs, they start doing like erections like a man would. And so in the inside, it's getting straight up, like it's getting ready to receive, okay? And then the outside, the everything is getting just ready. So yeah.
And that's one of the things why a lot of sex experts stress the importance of foreplay, because like when it's wintertime, you got to warm up the car. You got to get it ready to go. That's what foreplay is. And a lot of people take foreplay for granted. I get it. There's such thing as quickies and stuff. Sometimes it's okay. But to get that arousal, because your vagina does expand when you're aroused. So it gives everything time to calm down. It's like it's helping with the hormones and everything. And I think that people take that for granted. And a lot of guys don't realize when we say foreplay, we really need that foreplay. We need the time to relax, because without it, a lot of times we tensing up. We're expecting the pain, and we're making it worse. If you give me the foreplay, relax my body, relax my mind, I'm more receptive. My body's more receptive to it. And I don't think a lot of people take the time to realize foreplay is needed, like majorly. Like I tell people all the time, you got to do foreplay. Even when you're not going through the PCOS or endometriosis flares, if it's just regular sex, sex can be painful for me. When you have a well endowed partner for one.
Mhm.
Sometimes being well endowed is good, it's great. Sometimes it's like that shit
Calm
hurts.
down.
Like,
Mhm.
I'm not that deep for real. We got to pray about this. But that foreplay helps you get that arousal that you need so that they can slide in. But they still have to, even then, they still have to be aware of their partner. The fact that your partner is going to the doctor with you and learning about you is
Mhm.
helping him be more aware. That means he cares. And that's
Mhm.
one thing. Everybody needs a partner that's gonna be aware of them, because some positions may just hurt women in general just because
Mhm.
you jam it this way. Like, hold on, calm down. That's
Mhm.
like when I say I feel it in my stomach, you really hurting me.
Flag
Like,
on the
Mhm.
plate.
yeah. So I mean, and sometimes it's great to feel it there, but it's also very painful to feel it there. Sometimes if they're not doing it right, if you're not aroused right, if the position's not working right. I mean, we already hurting our legs being gymnasts. Let's be realistic. My leg don't go back that far on a regular. Like, I'm already hurting, everything's hurting, and then we got all this other stuff on top of it. Like, be gentle. Sometimes I like it rough, but calm down. But
Mhm.
if you're getting aroused beforehand, you didn't warm me up, you didn't set her. Matter of fact, they can make it a whole damn day of intimacy. Warm you up
Mhm.
all day. Start from the moment I wake up, sending me love letters, notes, texting me, warming me up all
Mhm.
day, making me dinner, a bubble bath. Let's do it all day.
Mhm.
Warm me up so my body will relax and
Mhm.
loosen up, and they
Mhm.
understand that. And even then, as a person who has your flirts whenever they happen, a partner will have to understand you might have did this all day and I still can't do it.
Mhm.
I might
Mhm.
not be able to do it. And I think one of the important things is, women, we have to realize we can, no is okay, no is fine. Like,
Mhm.
sometimes you have to say no, especially when it comes to
Mhm.
your health. You can't. Like, I have period cramps sometime a week before my period comes. And he's like, "What?" Listen, I have period symptoms down there this whole month. Okay, so you gotta come. It doesn't happen like that all the time, but I know when my cycle's coming because I know my
Mhm.
body, and I'm like, cramp. He's like, "You ain't time." I know it ain't time. It's the warning. It's the warning cramp that is
Yeah.
coming. Like, I get the warnings beforehand.
Freeze.
I'm like, I can't do
Mhm.
nothing today. Like, I
Mhm.
can't. Like, the cramps hurt so bad, and like you said, Motrin is not
Those are
shit.
Skittles. Motrin or Skittles, pretty much.
Yes, Motrin has never worked for me. Like, I had Tylenol. What is that? Give me some. Usually for me, I take at least Excedrin or ibuprofen or something. And people like, them ain't
Mhm.
that they good for you. Listen, baby, I'm hurting right now. I'll worry about the
Mhm.
good for me in a minute because I'm dying right now. Leave
Mhm.
me alone. Let me take my ibuprofen in peace because it's helping me right now. Because that Tylenol ain't gonna do nothing. And Motrin, my child's been through that. She's going through the whole cramping phases. We give her Motrin, and doctor prescribed the Motrin. I'm like, it's not helping. Don't worry. Give her this. It's not working. She's still crying. Why she's still crying? Why is she still going through it? So ibuprofen has to work. I pass my symptoms right on down to her. Uh, but it takes for somebody to really try to understand you and what you're going through. And I think that's dope that he goes to the doctor with you. Because I think it's dope for men to have to try to understand women on a regular,
Mhm.
not just in the sense of, because hell, sometimes our bodies just can't function right. Like, our bodies are
Mhm.
shit. We do everything all day. On top of that, then you got the health issues and stuff like that. You're
Mhm.
fucking tired. Like, it's not
Mhm.
out. It sounds peaches and cream to have sex like rabbits all the time. It sounds great.
Mhm.
It sounds
Mhm.
amazing to have sex every
Listen,
day, twice a day. That sounds so good. This is my reality. It's not happening. I'm sorry. I love you, but listen, babe, my body is not working, and that's important for you. I'm glad you do have that with your partner, because a lot of men,
Mhm.
like,
Mhm.
they make women come rags, like,
Mhm.
just to get theirs in. That's all that matters. As
Mhm.
long as they got what they came for, I'm good.
Yes,
And they do
I
that in
agree with that.
relationships too.
Having a great partner and knowing when you have a great partner, acknowledging, you know what I'm saying, you can take off your own BS and recognize what you're doing or not doing, and having a partner who's on the same page as you are. It's not easy to find. You got to weed through all the weeds, of course, but you know, having a partner who's supportive and understanding and trying to understand, because they don't know everything. We don't know everything either, but to try to understand, they're showing their caring, they're showing their compassion, things like that. That's what you need. That's what you have to have, especially when we have these women's issues that, we don't want to have to deal with it either, So if we had the choice, we wouldn't deal with none of it, but
Exactly.
having a solid partner is another topic for another day. It can go somewhere totally different, but that's very
Listen,
important to
preach.
have.
It definitely will be another topic for another day. But I just really like that you said that, just because the research and everything, and it
Mm-hmm.
helps men if you don't have a partner. Still,
Mm-hmm.
sometimes it helps to research women, because women don't understand women. Like when men say stuff about women, hell, we don't understand women. We still trying to learn ourselves and our bodies, and why
Mm-hmm.
our bodies do the things that it does. I mean, I'm still trying to figure out why we can bleed for so long and we still alive. You feel me? Like, that's the thing. Like, we superhuman. I don't care what nobody says. We superhuman. You bleed that long, you're not gonna make it. Me,
Not all heroes
I'm
wear capes, right?
right. Hey, listen, and they don't, and I think that more men should try to be understanding that in general, just
Mm-hmm.
because women do go through a lot of stuff that, trust, especially when it comes to just having a baby. That ain't no
Mm-hmm.
joke. That's a whole
Mm-hmm.
nother that's a whole nother, like, when I was pregnant, my child's father time, he hated that I couldn't have sex. I'm like, listen, I'm hurting. Every day this baby's doing something else. I don't like I lost 30 pounds while I was pregnant, because she wouldn't eat,
Mm-hmm.
for one. So I'm hungry. I'm angry and I'm hungry because I throw up everything I eat now. So leave me alone. Don't touch me. Then I'm in pain. I gotta use the bathroom 15 seconds after I left the bathroom, because she's sitting low the whole time, and she's hurting me. Don't touch me. Don't leave me alone. He was like, man, what? You did this. You remember how she get there? She got, and I'm
Mm-hmm.
like, it's painful. Like, I don't want to touch you. I know they say the pregnant's the best, but you're just not gonna find out. I want to tell you, like, this pregnancy ain't pretty, and I think that men don't realize that all the time. Every woman's body is literally different. What your ex
Mm-hmm.
did, or what your new girl doing, what your kids gonna go through. Hell, our kids gonna go through stuff, and we're gonna be like, what the hell is she going through?
Mm-hmm.
Because you never know. Like, hell, women, you said the menopause makes you emotional. Shit, we already emotional enough, and then we crying now at
Mm-hmm.
the drop of a dime. Good Lord Almighty,
Mm-hmm.
we already
Mm-hmm.
we already cried at the drop of a dime. Come on,
Right.
that's why I was like, when you said that, I'm like, I'm already emotional. I don't know if I need menopause.
Uh-huh.
I'm a
Like you say, there's
Pisces in
levels
this.
to it. There's levels to it.
Listen, I'm a
Yeah.
Pisces. I was born emotional. I'm a woman. I was even more emotional. Now I gotta go through menopause, and hell, I listen. We gonna leave that until I get older. Cause right now at 35, I don't need no more emotions to go nowhere. That's crazy to hear all of that. Like, and and Felicia, hopefully you can connect with Vontrese. Hopefully she can be a resource for you too. Since she is a specialist in this, because I really, I hate that you got to go through all that.
Yeah.
Yeah,
But
my primary care doctor actually does have me on like 1,000 milligrams of CBD because of my pain. So when
Mm-hmm.
you were talking about that
Absolutely.
CBD
Mm-hmm.
stuff, I was
Mm-hmm.
like, I
Yes.
need to see what's
Mm-hmm.
going on with that.
so
Absolutely.
CBD, so
Absolutely.
CBD really does. I know. Listen, I know. I've heard CBD helps with a lot of stuff.
Mm-hmm.
Hmm.
So does it help with? So it helps with the pain. Like, it really helps with.
Yeah. And
Hmm.
so so when we was all in science class in high school, middle school, they taught you about how the body works, the different organs in the body, the different you have your skin system, you have the cardiovascular system, you have the reproductive system, you have the respiratory system, you have all these systems, right? But nobody ever talked about the endocannabinoid system. Okay. There's a whole system in your body called the endocannabinoid system. And so the cannabis plants, hemp plants, um, those plants are used to excrete the THC, which is marijuana, or the CBD, to help regulate. We can eat that or take drops, take the creams, take the gels, take whatever, and it helps regulate your body. It's a natural substance we can use to regulate our ecosystem in our bodies. Okay. And so CBD is used to help you relax you. Is used for pain. Is used for um, seizures. It's used for all kind of things. Okay, it's non-psychoactive, so you're not going to get high from it. Okay, it's not like that at all. But you do want to take the right dose that's right for you. And sometimes you got to kind of, in the beginning, you got to kind of see, start low and slow and see what dose you need to get you where you need to be. It actually happens to be that the pelvic system, especially in a woman, has the most receptors for cannabis down in the pelvis, down the legs, up in the abdomen, in that area. So when we take cannabis in certain kind of ways for reproductive health, it should help a lot.
Hmm. You learn something new every day, because they didn't mention that in science and
No.
biology and none of that. They don't mention a lot of stuff in biology no more. I mean, hell, I don't even think they have sex ed no more half the time, and that's just crazy to me. I'm working on that part. I can work on that part, but that CBD stuff is real interesting. I knew CBD had a lot of benefits to it. We're gonna have to get you listening. We're gonna have to get you back down here in November to come to this convention that we're doing down here. I'm about to send you the flyer.
Yeah, let me know. I'll be there.
We're doing the first sex expo down here in Louisville. Sensual Bliss is putting it on, and we need vendors and everything.
Yeah, let me know.
You said you're gonna be what?
I'm a vendor. I signed up. Seeing how you called me out at the last show.
I do. I do call people out. But yeah, we need, that'll be a dope vendor to have, I think, especially with the CBD and just you in general.
Yeah. Let me know. Send me the information. I'm there.
I will, because she's looking for people to talk and do everything, and all the information tonight just helps out a lot, because I think, like with the profession I'm in, a lot of people misconstrue what I actually am a lot of times, and I have to tell them, yes, I know about sexual health, but I know about STDs and all of that. I had to learn all of that, but I'm not a doctor. I'm not a nurse. I'm not a doctor. I'm not clinical. Don't ask me to be clinical, because I don't do needles, blood, nothing. So the clinical part is not for me. And that's why, and then they think I'm a therapist half the time. No, baby, I cannot help you with those deep-rooted issues. I chose not to be a therapist because I realized, therapists need therapists. And after I'm done talking to some of y'all, I might be crazy. And I don't want them problems on my conscience, because I see what people, I see the issues that people really have when it comes to the sexual health, the sex lives. I can't, my mental capacity is not enough. It's already enough to me to help you with your sex life, but I can't help you with the issues. My mental capacity cannot deal with your issues. I've been that therapist for my friends, and my mental capacity just, so no, I can't do it. So, I think it's good to have the line of communication with the, nurse practitioners, with the therapist, because I tell people all the time, like, I ain't a therapist. You need therapy. I can't help you with the deep root issue. I help you get your sex life on track. Help you get it there. I help you get the help that you need, and just, because a lot of people confuse me for, a nurse and stuff. I'm just like, That's why I got people like you, because I'm like, I don't know what to tell you.
Reach out anytime. Reach out anytime if you need want to do another show about specific topics, or
listen,
we're gonna an expert somewhere. Let me know.
I ain't done an STD episode in a long time. And I'm starting to feel like I need to do another STD episode.
Those never go out of style. So
no, because there's a 1,000,001 STDs that people don't realize. And me working, I work in a doctor's office, and it's crazy. I work in a elder doctor's office for older people. It's amazing how many people.
They get it too.
They get it bad. I just be like, you ain't know. And it seems like I feel like older people get more carefree and they care less sometimes. And I'm just like, you just not gonna protect yourself. Like you're not gonna do it. You're just not gonna wear one.
They think they're invincible sometimes. Just like preteens, teenagers, they think nothing's ever gonna happen.
They literally revert back. Like older people will literally go backwards, literally revert back to your kids. Because they literally do think they're invincible. I mean, like, when my granny was alive, they had a problem in her nursing home. One of the guys was just messing with all the women. And I'm like, oh my God, it's one man's messing with all the women. Grow up. Grow up. So I'm like, they need condoms, because people are like, oh, people don't have sex.
Yes, they do.
They be having too much sex.
They have all the sex. They be having all of it.
And they don't be protecting themselves and washing their hands and doing the other stuff. I'm like, old people and young people are usually some of the people that need the sex education the most. Because it seems like the older you get, it goes out the window. And then you have these older people teaching these younger people incorrect information. Like, so I know I need another STD because I still think that people feel like condoms make you invincible for some odd reason. I'm just like,
no.
condoms don't make you invincible to nothing. I mean, there's still STDs you can contract from skin to skin, and a lot of people don't know that. Like I mentioned, my my daughter's 13, and I showed her my little pamphlet. She was like, pubic lice, crabs, what is that? I was like, it's STD. She was like, what? Like the kind you eat? You know what? Read this whole. I said, read this. That's why I handed it to you. I need you to read it so you won't think that people got real crabs on them.
Oh,
I said,
Lord.
Trinity, I said, Trinity, them are big. You can't get. I said, so not them kind. She was like, oh, so she read it, and I'm like, you know, because she's in that age where I talk to her on a regular now. Like we get the regular conversation. She hates
Yeah,
it.
absolutely.
She hates the conversations. I'm just like, I gotta check. Listen, child, we're gonna check every day. You in 8th grade. Um, all your friends got relationships and dating each other, and baby girl, you don't understand. I'm gonna keep talking to you until you blue in the face because you're not about to be out here misinformed. Because there's so many teenagers and adults. It's adults that still don't know what a vagina is.
Yeah.
So
there's a lot of women out there that don't know they have multiple holes down there.
Ask them how many they got. They'll tell you 2 every time. I'm like 2. I mean, a lot of women don't know the urethra from nothing else, and I'm like,
absolutely.
You know, I had to explain that to them. I have to explain that to them multiple times, and it's crazy. It's crazy that we have to, but then again, it's not crazy because we wouldn't have jobs if everybody knew everything. We'd be out of a job at that point. You feel me? So we're definitely gonna come back. We're gonna do that STD episode.
Okay.
But yeah, I really enjoyed this episode. I really learned some things about, because PCOS, endometriosis are words that I hear often, but knew not much about. But I know there's so many women, because I think one day on TikTok, I literally just went through they had a hashtag. I literally just went through the hashtag. I was looking at their videos, and everybody was just, talking about it and going through different stages, and I'm like, this is crazy. Like it's amazing. These women are in pain and they're still smiling in pain and still trying to push through and be moms and
still trying to live. Yeah, you got to live. Like your quality of life when you have these issues going on is decreased because you hurting all the time.
You can't stop being a mom. You got to be a mom through it all. And I know, Felicia, you're a mom, fiance, so you just you cook on a regular. You got your own business, so I know it's probably gets you down, and I'm sure it does. But you push through. You push through. If y'all need some cupcakes. She makes some bomb cupcakes. She makes a bomb cake. My birthday cake last year was both years, this year and last year. Hold up, pause. And the year before that, she made my 3 cakes. Yeah, she made bomb. You hear me? Like it's far. I don't know how she does it. She made them, and she was. I don't even think she was in business back in March this year, and you still made the cake.
No, I was not, but because I was having really bad pain flares, but I promised you a cake, so I made you a cake.
See, she made the cake through the flares. I knew she was going through a lot then, and she made the cake through it. See, it's amazing what women have to go through and do, but still push. Yeah. And I know you see it every day, Vontrese, in your field. Thank you. Listen, I just got to thank you just for being who you are, because that's amazing. And the CBD thing, we'll have to talk more about this. We're gonna have to.
Yeah. Like I said, I'm a nurse cannabis expert too. So you let me know. We're gonna have to definitely.
I'm gonna definitely get you back on the show. Felicia, when you're feeling better, we're gonna definitely get you back on the show for a live cooking episode again. We're gonna have to get that cracking again when you're cooking.
Yes, the aphrodisiac show we never did. We'll have to do that with my other business, my Enchanting Taste Buds.
Yeah, so. we'll get. I'm gonna get back with both of y'all. So thank y'all so much for being guests. Thanks everyone out there for tuning in to NeNe at Night. This is a dope episode. I hope y'all learned some things. If you have any questions, feel free to reach out to either one. They are, easy to talk to, easy to hit up. I hit up Vontrese on a whim, and she was like, I'm with it. Bam. Yeah. Listen. So hit them up there if you need some knowledge. She's not in Louisville, but she's here. You see how that works? She's still accessible. So make sure y'all hit them up. And my friend in the comments here, Summer Rain, I know she has dealt with that too a lot, and that's why she's in the comments. I tagged her. I made sure she's seen the episode. She's dealt with a lot of it as well, and she was making comments about it.
Go ahead, so Summer. I hear you. Pro CBD and THC.
Yeah, listen, pro CBD and THC. I'm pro whatever's gonna help us at this point, and that's
Mhm.
natural.
Right.
That's
Right.
natural, and that does less
Mhm.
damage to our bodies than all the pills and
Then
everything we
those all
take. So
those narcotics, they
yeah,
trying to, yeah.
so
It's
I'm
a whole
definitely
different story
pro that.
too.
That's why I think that's dope because if I ain't gotta take narcotics or something, because that was one of my biggest
Mhm.
fears growing up is being addicted to pills because I'm on my cramps are bad.
Yeah.
I don't want to be addicted. So that CBD, we're gonna have to talk. Give me some. We're gonna have to get us some of that down here. My daughter gonna need some of that too. So we definitely gonna
Mhm.
talk. But
Okay.
hit up either lady. When I post the stuff, I'll tag. I'll make sure I tag them. Their names are on here, but I'll make sure I tag everybody and get it done. Thank y'all for tuning in to another episode of NeNe at Night, and we out.